In a world where stress, pressure, and uncertainty are a daily reality for kids, knowing the difference between normal worry and anxiety and how to help matters more than ever. Let's hear directly from Juan Carballo, a licensed clinical social worker and Daybreak therapist, as he shares how to recognize anxiety and simple tips you can use to help.
Now, in my practice, day to day, I get these questions all the time. Like, well, isn't anxiety normal? Shouldn't kids kind of have these reactions? Right? And so I want to really start by talking about, yes, feeling nervous, feeling anxious is a typical reaction to situations. Maybe it's people, maybe it's thoughts, right? In fact, I'd love to say this, and please take this as your first, perhaps take away a little nugget you can take with you today, but that emotions, feeling anxious, can be messengers for what we need. Recently, I heard someone use the analogy that sometimes our emotions are like a compass. They're guiding us in the direction we might be benefited by heading in. Now, I want to talk about some signs because I think anxiety can be really misunderstood, but sometimes it's clear as day, right? Common signs and symptoms would be changes in mood. Changes in mood could tell us something is going on. Pay attention to that. And I want to give you this reference because we see the moody child, sad, angry even, worried, irritable, right? I have teenagers in my home. Irritability is very difficult to deal with sometimes. But if we're looking at it as it could be a sign of something else, we should pay attention to that. And I want to give you this reference. Instead of thinking my child is giving me a hard time, let's think they're having a hard time. Changing that reference from a cognitive behavioral approach says, what else could be going on? Other signs could be changes in appetite, changes in sleeping habits, or headaches, body pains, stomach issues. When we're anxious in our brain, we're in that fight or flight, that high stress state, and digestion, nope, that's not important. Right now, my body is just focusing on surviving. In school settings, we see that feeling sick as frequent trips to the nurse. That's a way to avoid. Yeah, not wanting to go to school. As parents, if I use that as a compass, why? What is it that's causing, what's at the bottom of not wanting to go to school? What is it that we're avoiding? Because that can truly start to direct the interventions that I'm going to be talking about. How do we support? Okay. When someone feels anxiety, panic, they can't label it. They may be feeling overwhelmed. They may be feeling judged. They may be feeling afraid. But this is where we can start to really tap in to how do we support? And the biggest one is exposure, right? I know that's a very scary thing. It's like, well, I don't want to be around people. I don't want to do that thing. But think of this as more small steps. This is exposing an individual to situations or objects or even thoughts in a safe environment. And typically that's done in a very hierarchical manner. So we start slow, we start small, and we step up with more, right? I had a child who was struggling, and it was a specific phobia. It was elevators. And so we started this by opening the elevator, literally just pushing the button. It opened. Okay, we're going to look. Okay, let's step back, slowly exposing to that stimuli over time, repeatedly, and then working on coping skills. And what we're learning is that when that exposure therapy can be uncomfortable, it also can start to demonstrate power or control over learning how to calm themselves, right? That's how it's done. The more we avoid, the more difficult those situations become, truly. I think that routines, right? Predictability. The more predictable waking up, school, even bedtime routines can be, the more children feel in control of that environment. I also think of positive reinforcement. Even for the smallest things, I know that was difficult, right? Praise and encouragement. And it's not about getting it perfect. It's about trying, right? But this idea of, well, when do I get help? How do I know when I should be seeking help? And I want to say this. You know your child the best. You absolutely are the expert on your own children. So when you notice changes in their functioning, you know what that functioning looks like. Ask for help. Seek out someone, talk to your school counselor. The earlier we intervene, the better the outcomes.